Hey, Tom. Nice to talk to you.
Thank you.
Couple things. You mentioned that gal just recently about how she passed away selling the vacuum.
Yeah,
And it didn't really
Charlene
make
Dill.
sense that she could have. How could she have 3 jobs and only make 10 grand a year? She must not be reporting all of her income. She's going through a 4th divorce. I am not feeling bad for this lady. I mean, I'm sorry she died, but I'm not going to blame the government of Florida and our Medicare system for an individual situation. Okay, that is the problem.
So, Aaron, I'm guessing
for
that the position that you're taking is you don't think that the government should be providing health insurance to people. Is that the bottom line here?
No, I think
Why
the government should try to get out of as much stuff as they can.
Why not?
They do not solve anything.
Aaron, why not?
They don't solve anything.
Aaron, why not?
Because the government is not a competitive organization. It takes from one group and gives to another.
So, Aaron, you're saying that health insurance should be competitive?
It should be 100% competitive.
Why?
Absolutely.
Why?
It should be a free market.
Why?
Free market like everything else.
Why?
Just like education.
Why?
Yeah, the government is not the answer. They never have been.
Aaron, why?
The government has survived the history of the world.
You don't.
The U.S. is going to survive.
Aaron, it's a very simple thing. You know, the purpose of the government, read your Constitution, was to promote the general welfare of the United States. There are some things that are part of the commons. They do serve the public good. Education and healthcare are 2 of those things, and those are areas where, when you look at every other developed country in the world, the only exception is the United States. We're the village idiots filled with people like Aaron. And every other country in the world has said, no, we're going to not only provide free education to everybody. Denmark pays students $200 a month to go to school, to go to college. We're not only going to provide national health care for everybody, but we're going to provide it with no deductibles whatsoever. That's the case in every other developed country in the world. And what do they get out of that? What do the people get out of that? What does Aaron get out of that? Lower costs, better education, and explosion. I mean, we saw this in the United States here, and after the World War II, when my dad came back from Japan on the GI Bill, went to college for 2 years, the GI Bill, for every $1 we spent on the GI Bill, sending young men to college for free, for every $1 we spent, by 1965, we had returned $7 in extra tax income to the federal government as a result of those people earning higher salaries than they would have made if they didn't have a college education. Education is an investment. Healthcare is an investment. If you have a healthy populace, we have maternal death rates, mothers dying in the United States at rates that are comparable to African countries. And I'm not talking the top of the line African countries. We have the highest maternal death rate in the developed world in the United States because we don't have a national health care system. Charlene Dill is an example of that. What don't you get about if everybody's healthy and if everybody's educated, it's better for the country?
Because people have to take personal responsibility. And people in this country can't.
Aaron, you have never taken personal responsibility. You didn't birth yourself. You didn't raise yourself. You didn't educate yourself. Personal responsibility. Don't give me this crap.
I have to get up. Every day I have to get up and deal with myself, and I never ask the government for shit. They just take it from me.
Yeah, Aaron, you can't use that word on the air, so I've got to beep you out. But you never ask the government for. Oh, jeez. I don't know how to get through. I don't. It just seems so obvious. Let me just recap real quickly and real cleanly. It is entirely appropriate that we have a private sector, and I don't want the government making my blue jeans. I don't want the government making my computer. I don't want the government making my car. But there are certain things that all of our fate hangs based on that have to do with the public good. Water, septic, electric, health care, education. These are the appropriate areas where, in fact, government does a better job than private industry.